Biden diagnosed with prostate cancer. Early symptoms hidden. Once these danger signs appear, check immediately. Hello everyone, welcome to today's video. Today we are going to talk about a particularly important health topic, especially for brothers in their 40s and 50s, which must not be ignored, that is prostate cancer. Recently, there was a news, and you may have heard that former US President Biden was diagnosed with aggressive prostate cancer, and the cancer cells have spread to the bones. This reminds us that no matter who you are, this disease may come to you. So today we will talk about what prostate cancer is, how to detect it early, deal with it early, and protect your health. Are you ready? Make a cup of tea, find a comfortable position, and let's get started. What is prostate cancer? Why should we pay attention to it? Let's first figure out what the prostate does. Simply put, the prostate is a small organ exclusive to men, about the size of a walnut, hidden under the bladder and in front of the rectum. Its main task is to help produce semen, which is the kind of liquid that swims with sperm. Prostate cancer is when the cells in this small organ begin to rebel, growing uncontrollably, and form a tumor. In Europe and the United States, prostate cancer is the big brother of male cancers, with a terrifying number of new cases each year, with hundreds of thousands of cases in the United States alone. In Asia, although the incidence rate is not that high, it has been quietly increasing in recent years, especially in cities, where lifestyles have changed and the disease has become more and more common. Why is it called the invisible killer? Because prostate cancer is particularly good at hiding, and it almost doesn't make a sound in the early stages. By the time you feel uncomfortable, it may not be in the early stages. It's like an uninvited guest in your home, quietly moving in and living there. If you don't notice it, it will slowly mess up your home. So, we have to learn to be a detective and pull this guy out as soon as possible. Early stage, silent lurker. Prostate cancer is particularly low-key in the early stages, like a ninja hiding in the dark, and doesn't give you any obvious signals at all. Many uncles feel that they are in great shape and have no discomfort, so they think they must be fine. Brothers, this idea is not good. Early prostate cancer cannot be detected by feelings, and professional examination methods must be used to solve the case. Health radar, PSA test. The first detective tool is the PSA test, which is called a prostate-specific antigen. Simply put, PSA is a protein secreted by the prostate. Under normal circumstances, it will appear in the blood, but in small amounts. We can think of it as a health signal light for the prostate. If the signal light is too red, be careful. Generally speaking, for healthy men under 40 years old, the PSA value is usually below 4 mmol. For uncles over 40 years old, 97% of people have a PSA between 0 and 4, and only 3% may be slightly higher, between 4 and 10. If your PSA value exceeds 4, hey, then you have to be vigilant. It may be prostate cancer playing tricks. However, don't panic. High PSA does not necessarily mean cancer. It may be prostate hyperplasia or inflammation, but further investigation is required. The doctor will also look at a ratio called free PSA FSA. The lower this ratio, the higher the possibility of cancer. Just like when checking accounts, you not only look at the total number, but also the details to make a more accurate judgment. Therefore, brothers over 40 years old, add a PSA test to the annual physical examination, just like doing an annual inspection for the car, to prevent problems before they happen. Old-fashioned key, rectal examination. The second tool is called a rectal examination. It may sound a bit embarrassing, but don't be shy. It is a classic examination method. The doctor will put on gloves and insert his fingers into your rectum to feel the size and hardness of the prostate and whether there are small bumps. If you feel a hard nodule, it may be that prostate cancer is exposing its feet. However, this method is also a bit controversial. Why? Because some early cancers grow too secretly to be felt by fingers, or the changes are too slight and easy to miss. There is a trial called Probase in Germany, which found more than 45-year-old men for screening, of which more than 6,000 underwent rectal examinations. As a result, only 57 people went for further biopsies due to suspicious conditions, and only 3 people were diagnosed with cancer in the end, which is much less efficient than PSA. Therefore, the rectal examination is a bit like an old-fashioned key. Although it is not perfect, it can still come in handy at critical moments. In short, early prostate cancer has no symptoms, and it can only be caught by physical examination. Brothers, don't be lazy and don't go for a physical examination because you don't feel anything. It will be too late to check when you have symptoms. Progressive stage, the troublemaker who starts to make trouble. If prostate cancer is not discovered early, the tumor will slowly grow and start to cause trouble for you. At this time, it is like a stone blocking the sewer, making your life less comfortable. Let's see how it will make trouble. Urinary tract obstruction. Urination becomes a tough battle. The prostate is right next to the urethra. Once the tumor grows, it is like a stone stuck in the water pipe. The urethra is squeezed narrower and narrower, and urination becomes a tough battle. What are the specific manifestations? Frequent urination. You will find that you always want to go to the toilet, running several times during the day, and have to get up several times at night. Sleeping well has become a luxury. It's like a faucet that is not closed tightly and always drips. Urgency. Sometimes you just feel like peeing, but before you even get to the toilet, the urine can't wait to rush out, which makes you flustered and embarrassed. Difficulty in urination. This is even more annoying. You have to stand in front of the toilet for a long time before the urine flows out slowly and thinly like a hair. Sometimes the urine flow is bifurcated, as if the nozzle is broken, and the urine distance is pitifully short, and you can't urinate far in half a day. Urinary retention. If the blockage is too severe, the urine cannot be discharged at all. The bladder swells like a balloon. The stomach bulges, and it hurts so much that you sweat. At this time, you have to go to the hospital quickly and let the doctor use a catheter to help you drain the urine, which solves the urgent problem. Many uncles have a greatly reduced quality of life due to these urination problems, so they go to the hospital for a checkup and find that it is prostate cancer that is causing the problem. So, brothers, if you have frequent urination, urgent urination, and difficulty urinating, don't think that it's just prostate hyperplasia due to old age. You have to be more careful and check the possibility of prostate cancer. Hematuria, a red alarm in urine. Another important signal is hematuria. Under normal circumstances, urine is clear or slightly yellow, like light beer. But if prostate cancer starts to make trouble, the tumor invades the urethra or bladder and destroys the blood vessels there. Blood will mix into the urine, and the urine will turn red, like meat washing water, or even like fresh blood. This kind of hematuria has a characteristic called painless macroscopic hematuria. What does it mean? It means that you can clearly see that the urine is red, but there is no pain when urinating. This is different from kidney stones or cystitis, which usually makes urine red and painful. So, if you find that your urine is red and it doesn't hurt, brother, this is a red alarm and you have to go to the hospital to check it out and rule out the possibility of prostate cancer or bladder tumors. Don't delay. Late stage, a storm hits the whole body. If prostate cancer is not controlled in time, in the late stages, cancer cells are like a group of crazy invaders, starting to mess around and metastasize to other parts of the body. At this time, the trouble is big. The body will send out various distress signals, and we must be especially careful. Bone pain, torture deep into the bone marrow. One of the places where prostate cancer loves to metastasize is the bones. Cancer cells run into the bones, just like drilling holes in the walls of your house, destroying everything. At this time, you will feel a deep and unforgettable pain. This kind of bone pain is not ordinary soreness. It may appear in the waist, buttocks, pelvis, ribs, sternum and other places. What does it feel like when it hurts? Sometimes it feels like a small insect gnawing in the bones. And it hurts dully. Sometimes it feels like being pressed by a heavy object. And it hurts dully. Sometimes it feels like a needle prick. And you can't stand it. Especially at night or when you are tired. The pain will worsen. And you will sweat profusely and it will be difficult to turn over. Many patients can take care of themselves. But once bone pain occurs, their lives are completely disrupted. If you start to have bone pain for no apparent reason, and you also lose weight and feel weak, you should be highly alert and go to the hospital for a checkup immediately. Don't let cancer cells set up camp in your bones. Pathological fractures. Bones are as fragile as tofu dregs. Cancer cells tossed around in the bones, not only causing pain, but also making the bones as fragile as tofu dregs. Normal bones are very strong, but after being damaged by cancer cells, they are not as strong as before, and they may snap and break with a little external force. This is called a pathological fracture. For example, you might just cough lightly, bend over, or even turn over in your sleep, and your bones will break. The spine, ribs, and femurs are high-risk areas. Spinal fractures may press on the spinal cord, causing numbness in the legs, weakness, or even paralysis. Rib fractures will make breathing painful and you dare not breathe. Femoral fractures will directly prevent you from getting out of bed. Therefore, patients in the late stage must be particularly careful. Walk steadily, do not put too many sundries at home, and do not make the ground too slippery to avoid falling. If you accidentally break a bone, go to the hospital immediately. The doctor will fix it with plaster or perform surgery to install a steel plate according to the situation and try to help you recover. Swollen lymph nodes, the signal light of the body. In addition to bones, cancer cells also like to run to lymph nodes. Lymph nodes are like the sentry of the body. Once cancer cells invade, the sentinels swelled and became small bulges. The lymph nodes in the groin and pelvis are most likely to be affected. They may swell as big as soybeans or peanuts. They feel hard and sometimes a little painful. If the swollen lymph nodes press on the blood vessels or nerves nearby, there will be more trouble. For example, if the lymphatic vessels are pressed, the legs may swell like elephant legs and the skin may be tight and shiny. If the nerves are pressed, the legs may be numb and painful. Therefore, if you find inexplicable small bumps in the groin or pelvis, after excluding infection and other reasons, you must check for prostate cancer immediately. Systemic symptoms, the body's full alarm. In the late stages, prostate cancer is like a storm sweeping the whole body, and the body begins to alarm comprehensively. Anemia, the face is as white as paper, and you can't breathe after walking a few steps, because the cancer cells affect the hematopoiesis of the bone marrow and there are not enough red blood cells. Fatigue, you are listless all day long. You have no energy to do anything, and you can't even do housework. Emaciation, there is no meat on the body. You are so thin that you are skinny, and your clothes are empty, because the cancer cells have robbed all the nutrients. Low fever, the body temperature always fluctuates around 38 C. Like there is a small stove in the body, burning you uncomfortable. Lower limb edema, in addition to lymph node compression. In the late stages, it may also be due to disordered metabolism and hypoproteinemia. And the legs are swollen like they are filled with water, and there is a pit when you press them. These symptoms sound scary, but don't be afraid. Today's medical technology is very powerful. Surgery, radiotherapy, chemotherapy, endocrine therapy, and targeted therapies can control the disease, relieving symptoms, and make you live longer and better. The key is to actively cooperate with the doctor and don't scare yourself. Finally, let me summarize: don't let the invisible killer succeed. Although prostate cancer is cunning, it is not completely without traces. Middle-aged and elderly brothers, you should pay more attention to the small signals of the body. Don't take frequent urination, urgency, and difficulty urinating seriously. If you find that your urine turns red, your bones hurt, and your lymph nodes are swollen, you must go to the hospital to check it out. Regular physical examinations are your firewall, especially PSA testing and rectal digital examinations. These two detectives can help you find problems early. If you are unfortunately diagnosed, don't panic, medicine is changing with each passing day. Scientific treatment can help you control the disease and improve your quality of life. Finally, I would like to give you a sentence: health is no small matter, and physical examinations are not lazy. Brothers over 40 years old, hurry up to arrange physical examinations. And don't let prostate cancer, the invisible killer, take advantage of the opportunity. See you in the next video. I wish you all good health and a happy life.